Welcome back, future RNs. You are now stepping into practice test 25 of our high-energy 30-day NCLEX challenge. And let us just say, you are crushing it. Every test you complete is not just another quiz. It is a stepping stone toward the career you have dreamed of. At this point, your brain is wired for clinical judgment, your instincts are sharper than ever, and your confidence, skyrocketing. In today's test, get ready for another powerful set of NCLEX-style questions designed to mirror the real exam. Every question is a chance to train your decision-making muscles for real patient care. Stay focused, stay hungry, and remember, success favors the prepared. And hey, if you are finding this challenge helpful, make sure you claim your free 5-day access to our complete NCLEX crash course. Just tap the WhatsApp link in the description and say hi to unlock live and recorded reviews, 5,000 plus practice questions, study planners, and so much more. All right, it is a go time. Let us jump into practice test 25 and keep that momentum rolling. Let us begin. Moving on to another critical emergency response scenario that reinforces the importance of prompt action in pediatric resuscitation. Question 1 asks, a nurse finds a 7-year-old child unresponsive, not breathing, and without a pulse. After immediately calling a code blue and activating the emergency response system, what is the nurse's next best action? The options are A. Begin cardiopulmonary resuscitation, using a compression to ventilation ratio of 15:2 for 2 minutes. B. Leave the child to retrieve an automated external defibrillator, then start cardiopulmonary resuscitation using a 30:2 ratio. C. Initiate 2 minutes of high-quality cardiopulmonary resuscitation with a compression to ventilation ratio of 30:1:2, and ask someone nearby to bring the automated external defibrillator, or D. Prioritize establishing intravenous access and prepare to administer epinephrine as soon as possible. The correct answer is option C. Initiate 2 minutes of high-quality cardiopulmonary resuscitation with a compression to ventilation ratio of 30:2 and ask someone nearby to bring the automated external defibrillator. Here is the rationale. When a nurse discovers a pulseless and apneic child between the ages of 1 year and puberty, the first intervention after activating the emergency response system is to begin immediate cardiopulmonary resuscitation. The American Heart Association advises that a single rescuer should use the 30:2 compression to ventilation ratio and should not delay compressions by leaving to retrieve an automated external defibrillator. Instead, the nurse should ask someone nearby to bring it while maintaining continuous and effective chest compressions. This approach maximizes the child's chances of survival by ensuring uninterrupted circulation until defibrillation becomes available. Jump our attention towards question 2. The nurse is caring for a client with end-stage renal disease who presents with critically low hemoglobin and hematocrit levels, as shown in the laboratory report. Based on these findings, which blood product does the nurse anticipate the healthcare provider will prescribe? Consider the options. A. Packed red blood cells, PRBCs. B. Fresh frozen plasma, FFP. C. Albumin. D. Platelets. Correct answer is A. Packed red blood cells, PRBCs, because the client's hemoglobin level has dropped to a critically low value, typically at or below 7 grams per deciliter, indicating symptomatic anemia that requires transfusion of packed red blood cells to improve oxygen carrying capacity and prevent tissue hypoxia. Now let us shift our focus from emergency care to hematological assessment in a clinical setting. Question 3 presents the following scenario. A nurse is assessing a client who presents with multiple bruises on the torso and arms without any recent trauma history. Which of the following laboratory findings most likely explains the client's bruising? The answer choices include A. White blood cell count of 4,500 per cubic millimeter, B. Platelet count of 70,000 per cubic millimeter, C. Activated partial thromboplastin time of 38 seconds, or D. Hematocrit of 40%. The correct answer is option B. Platelet count of 70,000 per cubic millimeter. Here is why. Platelets are essential for the formation of the initial clot at a site of injury, a process known as primary hemostasis. A platelet count this low indicates thrombocytopenia, a condition that greatly increases the likelihood of spontaneous bruising, petechiae, and bleeding even without trauma. Although the other lab values are either near normal or not directly associated with clotting deficiencies that lead to bruising, a platelet count of 70,000 per cubic millimeter clearly reflects impaired clotting ability. This explains the presence of unexplained bruising on the client's body and highlights the need for further evaluation and bleeding precautions. Stepping into the world of professional roles in nursing, question 4 focuses on collaboration within the healthcare environment. A nurse actively engages with colleagues both within and beyond their immediate healthcare team to make client-centered decisions and achieve shared goals. This behavior best reflects the nurse's role as A, collaborator, B, team leader, C, delegator, or D, manager. The correct answer is option A, collaborator. Here's the explanation. Collaboration in nursing is about engaging with professionals across disciplines, such as physicians, physical therapists, dietitians, and social workers, to ensure comprehensive, client-centered care. This role is centered around open communication, mutual respect, and coordinated decision-making, all of which improve outcomes and foster team synergy. Although being a team leader involves guidance and delegation, and a manager focuses on administrative oversight, this scenario highlights the nurse's ability to work across boundaries for shared decision-making, which aligns directly with the collaborator role. Nurses who excel in collaboration help bridge gaps between care providers, resulting in seamless transitions and more effective care plans. Now, shifting our attention to pharmacology and dosage calculations, question 5 presents a clinical math scenario. A primary healthcare provider prescribes dopamine at 5 micrograms per kilogram per minute. The client weighs 80.9 kilograms. The available solution is 800 milligrams of dopamine in 500 milliliters of dextrose, 5% water. How many milliliters per hour should the nurse set on the intravenous pump? The correct answer is 15 milliliters per hour. Let us break it down. First, multiply the prescribed dose by the client's weight. 5 micrograms times 80.9 kilograms gives 404.5 micrograms per minute. Multiply that by 60 to get an hourly dose of 24,270 micrograms, which converts to 24.27 milligrams per hour. Now apply the formula. Dose ordered divided by dose on hand multiplied by the total volume. So, 24.27 milligrams divided by 800 milligrams times 500 milliliters equals approximately 15.17 milliliters per hour. Rounding to the nearest whole number gives the final answer, 15 milliliters per hour. Accurate pump programming is critical in dopamine infusions because it influences renal perfusion and cardiac output depending on the dose range. Hey, before we dive into the next question, let me ask you something. What if you could prep smarter, not harder? Right now, you can get 5 full days of free access to our complete NCLEX crash course, and it is honestly a total game changer. We are talking live and recorded review classes, over 5,000 NCLEX-style questions, case studies, cheat sheets, and a personalized study plan, all designed to get you exam ready fast. There is no payment required. Just click the WhatsApp link in the description and type "Hi" to activate your free access instantly. This is your chance to boost your confidence and accelerate your success. Let us keep going. You are doing amazing. Turning now to fluid and electrolyte balance, question 6 assesses understanding of hydration therapy effectiveness. A nurse is caring for a client with a fluid volume deficit who is receiving intravenous fluids. Which of the following findings indicates that the client is responding positively to the treatment? The options are A, urine output of 20 milliliters per hour, B, blood urea nitrogen, BUN, of 15 milligrams per deciliter, C, urine specific gravity of 1.039, or D, flattened jugular veins. The correct answer is option B, blood urea nitrogen of 15 milligrams per deciliter. Here is why. Blood urea nitrogen is a sensitive indicator of hydration and renal perfusion. In dehydration, BUN is elevated due to hemoconcentration. When intravenous fluids are effective, BUN levels normalize. So a value of 15 milligrams per deciliter confirms that the client is responding to therapy. By contrast, the other options reflect ongoing fluid volume issues. Low urine output and elevated specific gravity suggest poor renal perfusion, and flattened jugular veins indicate persistent hypovolemia. This question reinforces that lab trends, especially BUN, should be closely monitored to evaluate treatment effectiveness. Finally, we move into the realm of fetal assessment with question 7, which presents a maternity care scenario. A nurse is reviewing a pregnant client's contraction stress test results, which reveal late decelerations in at least 50% of contractions. Based on this finding, What is the nurse's most appropriate next action? The answer options are A. Obtain an order for a biophysical profile screening. B. Document the results as within normal limits. C. Perform Leopold maneuvers. Or D. Obtain a urine specimen and assess for proteinuria. The correct answer is option A. Obtain an order for a biophysical profile screening. Here is the rationale. A positive contraction stress test, defined by late decelerations in 50% or more of contractions, signals utero-placental insufficiency and fetal intolerance to stress. This is a serious finding that requires immediate follow-up. A biophysical profile, or BPP, combines ultrasound evaluation with fetal heart rate monitoring to assess 5 critical areas: fetal movement, tone, breathing, amniotic fluid volume, and non-stress test reactivity. This test gives a comprehensive picture of fetal well-being. The other options do not directly address the abnormal CST result. Documenting the result as normal would be unsafe. Leopold maneuvers are unrelated to fetal oxygenation, and assessing for proteinuria does not evaluate fetal distress. The priority here is obtaining a BPP to guide timely intervention and ensure fetal safety. Let us now explore a calculation-based question that reflects the critical skill of medication safety. Question 8 asks, a nurse is preparing to administer an intravenous bolus of regular insulin to a client as prescribed by the primary healthcare provider. The order states to administer 0.1 unit per kilogram. The client weighs 242 pounds. How many units of regular insulin should the nurse administer? The options are A. 9 units, B. 10 units, C. 11 units, or D. 12 units. The correct answer is option C. 11 units. Here is the rationale. First, convert the client's weight from pounds to kilograms. 242 pounds divided by 2.2 equals 110 kilograms. Next, apply the dose. 110 kilograms multiplied by 0.1 unit per kilogram equals 11 units of regular insulin. This precise dosing approach is often used in managing diabetic ketoacidosis, where the initial insulin bolus plays a key role in reducing blood glucose levels and halting ketone production. The other options reflect common miscalculations. This question reinforces the need for accuracy, double-checking, and using actual body weight when performing weight-based insulin calculations. Switching gears from dosage to client education, question 9 focuses on medication interactions. A nurse is educating a client who has been prescribed a calcium channel blocker to treat primary hypertension. Which of the following foods should the nurse instruct the client to avoid while on this medication? The options are A. Eggs, B. Milk, C. Grapefruit, or D. Bananas. The correct answer is option C. Grapefruit. Let us understand why. Grapefruit contains compounds known as furanocoumarins, which inhibit the CYP3A4 enzyme in the liver and intestinal wall. This enzyme is responsible for metabolizing many drugs, including calcium channel blockers like amlodipine and verapamil. When grapefruit interferes with this metabolism, it can lead to dangerously high plasma drug levels, causing excessive vasodilation, severe hypotension, and bradycardia. In contrast, eggs, milk, and bananas have no direct interaction with calcium channel blockers. Nurses should always emphasize food-drug interactions during discharge education to prevent adverse outcomes and reinforce safe medication practices. Now, question 10 states, a 35 weeks pregnant client arrives at the emergency department reporting heavy, painful vaginal bleeding. Based on this clinical presentation, which condition should the nurse prioritize monitoring for? The options include A. Abruptio placentae, B. Placenta previa, C. Prelabor rupture of membranes, or D. Passage of the mucus plug. The correct answer is option A. Abruptio placentae. Here is why. Abruptio placentae is the premature separation of a normally implanted placenta from the uterine wall, and it presents with painful vaginal bleeding, often accompanied by abdominal pain, a rigid or tender uterus, and signs of maternal distress. It is a medical emergency that can lead to maternal hemorrhage, disseminated intravascular coagulation, and fetal hypoxia or stillbirth. Unlike placenta previa, which usually presents with painless bleeding, abruptio placenta is characterized by intense pain and potential hemodynamic instability. This is a classic red flag obstetric situation requiring immediate evaluation and possible delivery to save both mother and baby. Let us now focus on pediatric airway emergencies, starting with question 11. A nurse is assessing a child who presents with fever, difficulty swallowing, and is sitting in a tripod position. Which of the following would most likely be an expected clinical finding? The choices are A. Absence of spontaneous cough, B. Harsh, productive cough, C. Generalized skin flushing, or D. Coarse tremors. The correct answer is option A. Absence of spontaneous cough. Let us explore why. Epiglottitis is a medical emergency most often caused by Haemophilus influenzae type B, leading to inflammation and swelling of the epiglottis. A classic triad seen in affected children includes drooling, difficulty swallowing, and the tripod position to facilitate breathing. Critically, the cough is usually absent or very weak due to airway obstruction. This absence of spontaneous coughing reflects severe inflammation that can quickly progress to complete airway closure. Attempting to visualize the throat or using a tongue blade may precipitate full obstruction. So, airway management and emergency intubation preparation become the top priority. Other symptoms like flushing or tremors are unrelated to this condition and should not distract from identifying this life-threatening emergency. Next, let us examine cardiac medication safety with question 12. The nurse is caring for a client with a history of atrial fibrillation who has been prescribed dofetilide to maintain sinus rhythm. Before administering the first dose, which assessment should the nurse prioritize? The answer choices are A. Daily weight, B. Liver function tests, C. QT interval on the electrocardiogram, or D. Blood urea, nitrogen, and creatinine levels. The correct answer is option C. QT interval on the electrocardiogram. Here is the reasoning. Dofetilide is a class 3 antiarrhythmic that restores sinus rhythm by affecting cardiac repolarization. However, it significantly prolongs the QT interval, increasing the risk of a torsades de pointes, a dangerous ventricular arrhythmia. Because of this, checking the QT interval before giving the first dose is absolutely essential. Hospitalization is usually required for at least 3 days when initiating therapy, and continuous ECG monitoring is standard. Although kidney function is important for dosing and safety, the QT interval directly guides whether the medication can be safely started. Liver tests and weight are not directly relevant to this drug's immediate cardiac risks. Shifting now to post-operative care and clot prevention, question 13 asks, the nurse is caring for a post-operative client who is at risk for developing venous thromboembolism. Which of the following medications is indicated for VTE prevention in this client? The choices are A. Enoxaparin, B. Verapamil, C. Tranexamic acid, or D. Aspirin. The correct answer is option A. Enoxaparin. Let us clarify why this is the best choice. Enoxaparin is a low molecular weight heparin given subcutaneously, commonly used for VTE prophylaxis in surgical or immobilized patients. It works by inhibiting factor 10A, helping to prevent clot formation in deep veins. Verapamil, a calcium channel blocker, is used for cardiovascular conditions like hypertension or arrhythmias, not for clot prevention. Tranexamic acid actually stabilizes clots and may increase VTE risk. While aspirin has some antiplatelet effects, it is typically used to prevent arterial clots, such as those causing heart attacks or strokes, not venous clots. Enoxaparin is your go-to agent for safe and effective VTE prevention in the post-op setting. Let us move into the realm of psychiatric safety with question 14. A client recently admitted to the mental health unit with a history of bulimia nervosa makes several statements during initial assessment. Which statement requires the nurse's immediate follow-up? The options are A. These sores in my mouth hurt. B. I feel so bloated after eating. C. I barely slept at all last night. Or D. I feel really dizzy right now. The correct answer is option D. I feel really dizzy right now. Here is why. Dizziness in a client with bulimia nervosa is an urgent red flag. It can indicate serious electrolyte imbalances such as hypokalemia or dehydration from vomiting, laxative, or diuretic abuse. These complications can quickly lead to arrhythmias or syncope. While the other statements are concerning, they reflect chronic or emotional symptoms, such as oral injury, distorted body image, or insomnia, but do not signal an immediate physiological crisis. In mental health care, physical stability always takes priority over psychological symptoms. Dizziness may be the only warning sign before a serious event like cardiac arrest, so it must never be ignored. Let us now enter the realm of pediatric oncology and transplant care with question 15. The scenario states, the nurse is developing a care plan for a child recovering from a hematopoietic stem cell transplant. Which complication should the nurse consider as the most critical concern at this stage? The options are A. Infection, B. Delirium, C. Nutritional imbalance, or D. Oral mucositis. The correct answer is option A. Infection. Here is why. After a stem cell transplant, the child undergoes a prolonged phase of neutropenia, which leaves them extremely vulnerable to infections. Even minor exposures can lead to life-threatening sepsis due to their immunocompromised state. While oral mucositis, poor nutrition, and psychological symptoms like delirium are common, none pose the same level of immediate danger as infection. Nurses must implement strict neutropenic precautions, administer prophylactic antimicrobials, and monitor closely for fever, often the only early sign of infection. This question highlights the importance of prioritizing survival in complex pediatric care. Pause for a second. Feeling overwhelmed by your NCLEX prep? You are not alone, and you do not have to do it alone. We are offering you free 5-day access to our complete NCLEX crash course. No credit card, no catch. Inside, you will find expert-led classes, 5,000 plus high-yield questions, case-based learning, and a study system that finally makes sense. Just tap the WhatsApp link in the description and send "Hi." In less than a minute, you will be inside the course that has helped thousands of students pass with confidence. Ready to trade stress for strategy? Let us jump back into the lesson. Transitioning to the care of critically ill adults, question 16 addresses septic shock monitoring. A client in septic shock is receiving multiple intravenous vasopressors to support blood pressure. To evaluate if the client is responding appropriately to therapy, the nurse anticipates that the healthcare provider will order which of the following? The options are A. An arterial line, B. A chest tube, C. Mechanical ventilation, or D. An indwelling urinary catheter. The correct answer is option A. An arterial line. This is because continuous real-time blood pressure monitoring is essential when titrating vasopressors like norepinephrine. An arterial line allows for accurate measurement of mean arterial pressure and can be used for frequent blood gas sampling. Without this, clinicians cannot safely adjust medication doses to stabilize the client. Although the other interventions may support overall care in septic shock, only the arterial line directly reflects the client's response to vasopressor therapy. Next, let us revisit the fundamentals of infection control in question 17. A nurse has recently completed a continuing education program on infection prevention. Which of the following actions best demonstrates correct understanding of the training? The choices include A. Wearing gloves when obtaining vital signs, B. Cohorting 2 clients with influenza in the same room, C. Wearing a surgical mask when caring for a client with suspected rabies, or D. Initiating droplet precautions for a client with viral pneumonia. The correct answer is option B. Cohorting 2 clients with influenza in the same room. Influenza is spread via droplet transmission, and when isolation rooms are limited, it is appropriate to place clients with the same illness together. This conserves resources and limits cross-contamination. Wearing gloves for routine vital signs is not necessary unless there is an expected exposure. Rabies is not transmitted by droplets, and not all viral pneumonias need droplet precautions unless the pathogen is known to be airborne or droplet spread. Correct cohorting practices reflect a deep understanding of transmission-based precautions. Shifting now into developmental psychology, question 18 examines Freud's stages. The nurse is discussing Freud's psychosexual development theory with a student nurse. Which statement correctly identifies a milestone associated with the anal stage? The options are A. Seeing itself as separate from the caregiver, B. The onset of puberty, C. Toilet training, or D. Developing emotional relationships. The correct answer is option C. Toilet training. According to Freud, the anal stage occurs between 18 months and 3 years of age and centers on issues of control and autonomy through elimination. The process of toilet training symbolizes a key developmental achievement during this phase. Other options represent different stages. Emotional bonding appears during the phallic and latency periods. Self-awareness aligns with Erikson's autonomy versus shame phase, and puberty begins the genital stage. Understanding Freud's model helps nurses recognize behavioral responses rooted in early childhood experiences. Finally, Let us reinforce the safety foundations of nursing with question 19. The nurse is preparing to administer a prescribed medication. After verifying the right medication, dose, route, and time, what should the nurse do next? The answer choices are A. Confirm the client's identity using 2 client identifiers. B. Explain the purpose and side effects of the medication. C. Ensure the medication is within its expiration date. Or D. Document the medication administration in the client's record. The correct answer is option A. Confirm the client's identity using 2 client identifiers. This step fulfills the 5th right of medication administration, right client. Using 2 identifiers such as name and date of birth prevents potentially catastrophic medication errors. While client education, documentation, and checking expiration dates are also essential, confirming identity is the final critical step before administering the drug. It is a key action for promoting client safety and meeting legal standards of care. Let us begin this next set with a newborn scenario focused on immediate post-delivery care. Question 20 asks, a nurse is caring for a newborn immediately after birth. Which of the following actions would be most appropriate in the first few minutes of life? The options include A. Perform APGAR assessments at 5 and 10 minutes. B. Suction the nose, then the mouth. C. Administer Rho, D. Immune globulin intramuscularly. Or D. Place the infant skin to skin with a parent. The correct answer is option D. Place the infant skin to skin with a parent. Here is the rationale. Skin-to-skin contact is an essential and evidence-based intervention during the golden hour after birth. It helps stabilize the newborn's heart rate, temperature, and blood glucose levels, while promoting bonding and initiating breastfeeding. It also significantly reduces the risk of cold stress. APGAR scoring is correctly performed at 1 and 5 minutes, not at 5 and 10. If suctioning is needed, the mouth is suctioned before the nose, and routine suctioning is no longer standard unless there is obstruction. Lastly, Rho-D immune globulin is given to Rh-negative mothers, not to newborns. Now shifting to a life-threatening cardiac rhythm disturbance, question 21 presents, a client with complete third-degree atrioventricular block presents with hypotension. What is the most appropriate nursing action? The answer options are A. Prepare the client for temporary transcutaneous pacing. B. Obtain a prescription for an esmolol infusion. C. Begin chest compressions. Or D. Instruct the client to perform the Valsalva maneuver. The correct answer is option A. Prepare the client for temporary transcutaneous pacing. Complete AV block means that the atria and ventricles are not communicating at all, resulting in severe bradycardia and reduced perfusion. This is a true medical emergency, and temporary pacing is the first-line treatment to restore heart rate and stabilize blood pressure. Beta blockers like esmolol are contraindicated as they can worsen conduction delays. Chest compressions are not appropriate unless the client is pulseless, and the Valsalva maneuver is used to treat tachycardia, not bradycardia. Pacing must begin quickly to prevent cardiac arrest and maintain adequate perfusion. Transitioning into obstetrics, question 22 asks about physiological changes during pregnancy. A nurse is caring for a pregnant client who shows a decrease in red blood cell concentration after becoming pregnant. What is the most appropriate explanation for this physiological change? The options are A. Decrease in circulating red blood cells, B. Increase in plasma, C. Increase in iron demands from the body, or D. Decrease in heart size. The correct answer is option B. Increase in plasma. This condition is known as physiological anemia of pregnancy. During pregnancy, plasma volume increases significantly, by nearly 50%, while red blood cell production increases more slowly. This disproportion creates a dilutional effect, lowering hemoglobin and hematocrit levels despite no actual loss of red blood cells. While iron demands do rise and supplementation is often needed, the primary mechanism of this mild anemia is hemodilution. The heart does not shrink. Instead, cardiac output increases to meet the metabolic needs of the mother and fetus. This question emphasizes understanding normal adaptations versus pathological findings. Let us now apply our critical thinking to lab interpretation with question 23. A client receiving continuous nasogastric suctioning has the following ABG results. pH 7.50, PaCO2 42 millimeters of mercury, and HCO3 35 milliequivalents per liter. What acid-base disturbance does the nurse correctly identify from these results? The options are A. Respiratory acidosis, B. Respiratory alkalosis, C. Metabolic acidosis, or D, metabolic alkalosis? The correct answer is option D, metabolic alkalosis. Let us decode this. A pH above 7.45 indicates alkalosis. PaCO2 is within the normal range, meaning the issue is not respiratory. Bicarbonate is elevated, which confirms a metabolic origin. Continuous gastric suctioning removes hydrochloric acid from the stomach, leading to a net alkaline state in the body. This is a classic cause of metabolic alkalosis. Respiratory acidosis or alkalosis would involve abnormal carbon dioxide levels, and metabolic acidosis would feature low bicarbonate, not elevated. Always use the full ABG panel and clinical context to determine the source of the imbalance. Finally, question 24 asks, a client is newly diagnosed with peptic ulcer disease. Which of the following medications is most likely to be prescribed to reduce gastric acid and support ulcer healing? The answer options are A, ondansetron, B, diphenoxylate with atropine, C, famotidine, or D, psyllium. The correct answer is option C, famotidine. This drug is an H2 receptor antagonist that works by blocking histamine stimulation of gastric parietal cells, thereby reducing stomach acid secretion. It promotes ulcer healing and helps prevent recurrence. Ondansetron treats nausea, diphenoxylate is used for diarrhea, and psyllium is a bulk-forming laxative, none of which address acid suppression. In peptic ulcer disease, medications like famotidine or proton pump inhibitors are mainstays of therapy, often combined with antibiotics if Helicobacter pylori infection is present. This question reinforces targeted pharmacologic treatment based on pathophysiology. Let us now shift into the realm of prenatal counseling with question 25, which addresses dietary safety in pregnancy. A pregnant client attending a prenatal education session asks about safe eating habits. Which response by the nurse is most accurate? The options are A, you can eat raw sushi during pregnancy if it's high in protein. B, limit your caffeine intake to under 200 milligrams each day. C, strawberries are one of the best sources of dietary iron. Or D, your sodium intake should be less than 1 gram per day while pregnant. The correct answer is option B, limit your caffeine intake to under 200 milligrams each day. Here's the rationale. Excessive caffeine has been linked to miscarriage, fetal growth restriction, and preterm birth. That is why the current recommendation is to keep caffeine intake below 200 milligrams per day, or about 1 small cup of coffee. Raw sushi is unsafe in pregnancy due to risk of parasites and bacterial infection. Strawberries are high in vitamin C, which aids iron absorption, but they are not a rich source of iron themselves. As for sodium, it is not heavily restricted unless the client has a specific medical condition. In fact, sodium needs slightly increased to support expanded blood volume. This question reinforces practical, evidence-based prenatal education. Let us be honest, NCLEX prep can feel like too much sometimes. But imagine having every tool you need right in your pocket. That is exactly what you get with our free 5-day trial of the complete NCLEX crash course. From live coaching to downloadable PDFs, clinical case walkthroughs, and 5,000 plus real exam questions, you will have everything top scorers use. No sign-up hassles, just click the WhatsApp link below and message "Hi" to get started. It is fast, it is free, and it works. Let us get back to the questions. You are crushing this. Now transitioning into pediatric eye health, question 26 explores infection identification. A child presents with itchiness, discharge, and irritation in the right eye. Based on these symptoms, the nurse identifies that the child is most likely developing which condition? The options include A, conjunctivitis, B, amblyopia, C, nystagmus, or D, ocular herpes. The correct answer is option A, conjunctivitis. Here is why. These symptoms, itching, redness, and eye discharge, are classic for conjunctivitis, or pink eye. This condition is often viral or bacterial and is highly contagious in children. Unlike amblyopia, which is a developmental visual deficit, or nystagmus, which involves involuntary eye movement, conjunctivitis includes active signs of inflammation. Ocular herpes may cause vesicular lesions or corneal involvement, but it typically does not present with purulent discharge. Nurses should educate caregivers about hand hygiene, avoiding contact lens use, and keeping children out of school until at least 24 hours after antibiotic treatment begins, if the infection is bacterial. Let us now examine surgical education with question 27, which focuses on bariatric post-operative care. A client scheduled for gastric bypass surgery is reviewing discharge instructions. Which statement indicates a misunderstanding and requires further follow-up? The options are A. Once I'm home, I can advance my diet as tolerated. B. I will have to take a multivitamin after the surgery. C. I will be encouraged to perform leg exercises while I'm in bed. Or D. My weight may increase if I do not change my eating habits. The correct answer is option A. Once I am home, I can advance my diet as tolerated. Here is the rationale. After gastric bypass, diet progression is strictly structured and physician-guided. Clients must follow a staged approach that begins with clear liquids and progresses slowly to solids. Advancing the diet on one's own can result in nausea, vomiting, or dumping syndrome. In contrast, the other responses are accurate. Multivitamins are necessary long-term due to potential malabsorption, leg exercises prevent venous thromboembolism, and continued dietary discipline is essential for sustained weight loss. Nurses must emphasize that post-operative safety starts with following prescribed dietary phases. Let us explore a high-acuity scenario in question 28, which focuses on diabetic ketoacidosis. A client presents to the emergency department with diabetic ketoacidosis. Which of the following findings should the nurse prioritize for immediate intervention? The choices are A. Respiratory rate of 23 breaths per minute. B. Blood glucose level of 319 milligrams per deciliter. C. Mean arterial pressure of 51 millimeters of mercury. Or D. Partial pressure of oxygen, PaO2, of 90 millimeters of mercury. The correct answer is option C. Mean arterial pressure of 51 millimeters of mercury. Let us explain why. A MAP below 60 millimeters of mercury means that vital organs are not receiving adequate blood flow. In the setting of DKA, where dehydration and acidosis are already major concerns, a MAP this low is a medical emergency. It requires immediate fluid resuscitation to prevent shock and preserve organ function. The respiratory rate may be slightly elevated as compensation for metabolic acidosis. This is expected. The glucose level is elevated but not the most urgent concern, and the PaO2 is normal. Always prioritize perfusion first in critical care, and in DKA, restoring circulation is step 1. Let us now turn our attention to pharmacology with question 29, which asks, the nurse is reviewing a newly prescribed medication, amphotericin B, for a hospitalized client. The nurse correctly understands that this medication is primarily used to treat which type of infection? The options are A. Autoimmune infections, B. Fungal infections, C. Viral infections, or D. Bacterial infections. The correct answer is option B. Fungal infections. Here is why. Amphotericin B is a powerful antifungal agent used to treat severe systemic fungal infections, such as cryptococcosis and histoplasmosis. Due to its potency and toxicity, it is reserved for life-threatening infections and often requires pre-medication with acetaminophen, diphenhydramine, and IV fluids to reduce infusion-related reactions like fever, chills, and nephrotoxicity. It is not used for autoimmune, bacterial, or viral conditions, which are treated with entirely different classes of medications. Nurses must monitor renal function closely and use central lines to prevent phlebitis when administering this drug. This question emphasizes recognizing drug class and therapeutic use, a core NCLEX pharmacology skill. Now let us dive into critical care with question 30, which explores ventilator management. The nurse is reviewing an arterial blood gas result for a client on mechanical ventilation that shows respiratory acidosis. Which medication should the nurse expect the provider to prescribe? The options are A. Pancuronium, B. Midazolam, C. Theophylline, or D. Famotidine. The correct answer is option C. Theophylline. Here is the rationale. Respiratory acidosis occurs when the lungs fail to remove enough carbon dioxide, often due to hypoventilation or obstructive pulmonary issues. Theophylline is a bronchodilator that improves respiratory effort by relaxing airway smooth muscles and enhancing alveolar ventilation. Pancuronium and midazolam would further suppress breathing and worsen the problem. Famotidine is unrelated to respiratory function. In ventilated clients, the goal is to optimize gas exchange and theophylline can help correct acidosis caused by airflow limitation. Nurses should also monitor ABG trends and ventilator settings for further adjustment. Next, we move into musculoskeletal pharmacology with question 31. A client with osteoporosis is prescribed alendronate. When teaching about this medication, the nurse explains that the primary therapeutic action is to do what? The options are A. Decrease bone inflammation, B. Increase synovial fluid in joints, C. Inhibit bone resorption, or D. Raise serum calcium levels. The correct answer is option C. Inhibit bone resorption. Alendronate is a bisphosphonate that works by suppressing osteoclast activity, thereby slowing down the breakdown of bone. This helps preserve bone density and prevents fractures, especially in postmenopausal women and clients with low bone mass. It does not reduce inflammation, affect joint fluid, or raise calcium levels. In fact, it may slightly lower calcium by preventing it from leaching out of bone. Key nursing instructions include taking alendronate on an empty stomach with water and remaining upright for at least 30 minutes to avoid esophagitis. This question underscores understanding both the mechanism and safe administration of osteoporosis medications. Let us conclude this segment with question 32, which addresses facial nerve dysfunction. The scenario is, the nurse is caring for a client experiencing an acute exacerbation of Bell's palsy, who is unable to fully close one eye due to facial paralysis. Which intervention is most appropriate to protect the affected eye? The choices are A. Secure an eye patch using adhesive tape at all times. B. Advise the client to keep both eyes closed as much as possible. C. Assess the pupil for changes in size and light reaction. Or D. Apply the prescribed ocular lubricant to the affected eye regularly. The correct answer is option D. Apply the prescribed ocular lubricant to the affected eye regularly. Bell's palsy impairs cranial nerve 7, affecting eyelid closure and blink reflex. Without proper care, the exposed cornea is at risk for dryness, abrasions, and ulcers. Frequent application of lubricating drops during the day and ointment at night protects the eye until facial movement returns. Eye patches may be used at night but should not be worn continuously. Pupil assessment is important but not the priority in this case. This question highlights a classic nursing intervention for facial paralysis to protect vision and promote comfort. Let us now walk through a practical skills scenario in question 33, which focuses on peripheral intravenous IV catheter insertion. The nurse is preparing to insert a peripheral IV catheter in an adult client. What is the correct sequence of actions to ensure safe and effective placement? The correct order is 1. Place the tourniquet 10 to 15 centimeters above the proposed site. 2. Palpate the selected vein by pressing downward. 3. Release the tourniquet temporarily. 4. Clean the insertion site using 2% chlorhexidine with friction for 30 seconds. 5. Reapply the tourniquet. 6. Insert the IV catheter at a 15 to 30 degree angle. 7. Advance the catheter into the vein upon blood flashback and remove the stylet. 8. Release the tourniquet and attach the Luer lock extension tubing. And 9. Apply a sterile dressing over the insertion site. This sequence follows a systematic and aseptic technique for peripheral IV insertion. Releasing the tourniquet before antiseptic cleaning ensures better skin perfusion and disinfectant penetration. Reapplying the tourniquet after cleaning helps re-engorge the vein for catheter insertion. Advancing the catheter after flashback and securing with dressing are standard safety practices. Remember, never tape over a wet antiseptic site. Drying time is essential for effectiveness. Shifting now to orthopedic safety, question 34 presents a scenario where a nurse is caring for a client who recently had a cast placed on their right lower extremity. Which client statement should be of greatest concern to the nurse? The options include A. I've been having pain in my right calf. B. My right leg feels really itchy. C. I have not been keeping my leg elevated while in bed. Or D. My hands and arms support my body weight while using crutches. The correct answer is option A. I've been having pain in my right calf. This is concerning because pain in a casted limb can signal neurovascular compromise or even early signs of compartment syndrome. It demands immediate assessment. While itching is common under a cast and failing to elevate the leg may worsen swelling, these do not indicate urgent pathology. The final option about using crutches correctly is appropriate and shows safe practice. Nurses must regularly perform neurovascular checks after casting and educate clients about warning signs such as pain, tingling, and swelling. These are not to be ignored. Next, in question 35, we examine proper post-procedure positioning. The nurse is positioning a client following a liver biopsy. Which position is best suited for this client? The options are A. On the left side with a pillow under the ribs, B. Supine with a pillow under the knees, C. Face down with a pillow under the hips, or D. On the right side with a pillow under the biopsy site. The correct answer is option D. On the right side with a pillow under the biopsy site. This position uses gravity and direct pressure to reduce bleeding risk at the site of the biopsy, which is typically done through the right upper abdomen. Lying on the left side or supine provides no direct compression to the liver area. The prone position is also not appropriate for hemorrhage control. Nurses must always prioritize post-procedural bleeding prevention, and for liver biopsy, right side lying with pressure is the gold standard. Quick pause. If you are watching this, it means you are serious about passing. So, why not fast-track your success? We are giving away free 5-day access to our complete NCLEX crash course. No payment needed. You will unlock targeted reviews, daily study plans, 5,000 plus NCLEX level questions, and high-yield case studies, all taught by experts who know exactly what the exam is testing. Just hit the WhatsApp link in the description, send hi, and boom, you are in. Take advantage while it is still available. Let us get back to it. You are on fire. Lastly, question 36 focuses on pediatric genetic conditions. A nurse is caring for a child with osteogenesis imperfecta, OI. Which nursing intervention is a priority in the care of this client? The choices are A. Implementing measures to prevent falls and fractures, B. Administering calcium supplements to promote bone mineralization, C. Encouraging weight-bearing exercises to strengthen bones, or D. Applying heat packs to relieve muscle pain and stiffness. The correct answer is option A. Implementing measures to prevent falls and fractures. OI is a collagen disorder, not a calcium deficiency, and it results in fragile bones that break easily, often from minimal or no trauma. While calcium supplements and heat therapy may provide support or comfort, they do not address the primary risk, which is injury from fragility. Weight-bearing exercises, while good for general bone health, can actually be dangerous in these clients and are not encouraged unless under strict medical guidance. The priority is always safety and fracture prevention in children with OI. Question 37, which explores staff behavior and emotional wellness. The scenario reads, while managing the medical surgical unit, you observe that one of your seasoned nurses has been acting irritable and withdrawn, behavior that is unlike their usual demeanor. What is the most probable explanation for this change? The options are A. Professional burnout, B. Conflict and understanding of role expectations, C. Inability to fulfill job responsibilities, or D. Temporary physical tiredness. The correct answer is option A. Professional burnout. Here is the rationale. Burnout manifests through emotional fatigue, cynicism, frustration, and sometimes apathy, all signs of psychological exhaustion after prolonged stress. It affects even high-performing nurses and is often mistaken for mood swings or fatigue. Role confusion may lead to uncertainty, but it does not typically cause irritability. There is no evidence here of clinical incompetence, and simple tiredness does not explain emotional withdrawal or behavioral changes. Recognizing burnout early allows nurse managers to provide support, promote self-care, and protect mental health in the workplace. Next, question 38 shifts our attention to specimen collection and infection control. The scenario is, the physician has ordered a clean catch urine sample from a client. Which instruction is most appropriate for the nurse to give? The options include A. Begin collecting urine from the very first stream. B. Start collection midstream after initiating urination. C. Capture only the last part of the urine stream. Or D. Fill the specimen container with the entire volume of void. The correct answer is option B. Start collection midstream after initiating urination. This method minimizes contamination from skin flora or urethral bacteria. By discarding the initial stream and collecting the cleaner midstream urine, the beginning and end of the stream are both more likely to carry contaminants. Filling the entire container is not required and could even dilute the sample. This question reinforces core aseptic techniques to ensure accurate urine culture results and avoid false positives. Moving forward to dosage calculations. Question 39 challenges your IV math skills. A provider prescribes 500 milliliters of normal saline to be administered over 4 hours through IV microdrip tubing. Using a drip factor of 60 drops per milliliter, how many drops per minute should the nurse set the infusion at? The correct answer is 125 drops per minute. Let us calculate. 500 milliliters times 60 drops per milliliter equals 30,000 drops. Divide that by 240 minutes, and you get 125 drops per minute. Microdrip tubing always uses 60 GT per milliliter, so it is critical to remember that constant when calculating flow rates. Also, flow rates should always be rounded to the nearest whole number, unless otherwise instructed. This question underscores both accuracy and speed in clinical math, essential for safe infusion management. Now let us address reproductive health in question 40. A female client arrives at the clinic after having unprotected sexual intercourse 24 hours ago. She wants to prevent pregnancy. Which medication should the nurse expect the healthcare provider to recommend? The options are A. Levonorgestrel, B. Tamoxifen, C. Finasteride, or D. Methotrexate. The correct answer is option A. Levonorgestrel. Known as Plan B, levonorgestrel is an emergency contraceptive that works by delaying ovulation, which reduces the chance of fertilization. It must be taken within 72 hours of unprotected intercourse for maximum efficacy. Tamoxifen is used in breast cancer prevention, finasteride is for prostate conditions, and methotrexate is used for ectopic pregnancies or autoimmune diseases. But none of these are emergency contraceptives. Nurses must also educate clients that levonorgestrel does not terminate pregnancy, and it is not the same as abortion pills. This distinction is important to avoid confusion and stigma. Finally, question 41 covers delegation and infection control. The scenario asks, a client with a vancomycin-resistant enterococcus, VRE infection, has been placed under isolation precautions. The nurse is determining which task may be safely assigned to the unlicensed assistive personnel, UAP. The choices are A. Set up gloves and gowns outside the room for staff use. B. Instruct the client's family about VRE prevention techniques. C. Place a sign indicating droplet isolation on the door. Or D. Evaluate whether the client understands when to perform hand hygiene. The correct answer is option A. Set up gloves and gowns outside the room for staff use. This falls within the UAP's scope and supports standard contact precautions for VRE. In contrast, education, evaluation, and isolation sign decisions involve clinical judgment and must be handled by the registered nurse. Delegation decisions must always consider the training and role limitations of support personnel, and this scenario highlights that distinction perfectly. Now let us examine proper delegation strategy with question 42, which reads, the charge nurse is assigning clients to a licensed practical vocational nurse, LPN-VN. Which client is the most appropriate for the LPN/VN to care for? The options are A. A client with an arm cast and suspected compartment syndrome. B. A client who is immediately post-operative following prostate resection and reporting bladder spasms. C. A client with paralytic ileus requiring nasogastric tube insertion. Or D. A client newly diagnosed with hepatitis A who needs discharge instructions. The correct answer is option C. A client with paralytic ileus requiring nasogastric tube insertion. Here is why. LPNs are qualified to perform skill-based procedures such as inserting a nasogastric tube and managing stable conditions like paralytic ileus. However, option A involves a potentially life-threatening complication, compartment syndrome, which requires rapid neurovascular assessment and escalation, placing it firmly within the registered nurse's scope. Option B is also inappropriate because immediate post-operative clients are considered unstable, especially following urological procedures, which carry a bleeding risk. Option D requires initial discharge education, a responsibility reserved for the RN. This scenario reinforces the rule. LPNs can perform tasks and monitor stable clients, while RNs manage unstable conditions and patient education. Let us now turn to client education and chronic gastrointestinal conditions with question 43. The nurse is teaching a client with a hiatal hernia how to manage symptoms and prevent complications at home. Which client statement reflects a correct understanding of the instructions? The options are A. I need to wear loose-fitting clothes. B. I should lie down after eating to avoid complications. C. I will eat 3 large meals every day. Or D. Spicy food is fine as long as I eat slowly. The correct answer is option A. I need to wear loose-fitting clothes. This reflects an accurate understanding because tight clothing increases intra-abdominal pressure, which worsens gastroesophageal reflux, one of the hallmark complications of a hiatal hernia. Option B is unsafe since lying down after eating increases the chance of reflux. Clients should remain upright for at least 2 hours post-meal. Option C is inaccurate because large meals contribute to gastric distension and herniation risk. Option D is also incorrect. Spicy foods are known triggers of reflux symptoms and should be limited. Key teaching for hiatal hernia includes: eat small, frequent meals, stay upright after eating, avoid trigger foods, maintain a healthy weight, and wear loose-fitting clothing. This promotes symptom control and complication prevention. Switching to pharmacology and drug safety, question 44 asks, a client has been newly prescribed salmeterol for long-term asthma control. Which of the following current medications should the nurse report to the primary healthcare provider due to a potential interaction? The options include A. Lithium, B. Captopril, C. Labetalol, or D. Clonidine. The correct answer is option C. Labetalol. Let us explain. Salmeterol is a long-acting beta agonist, LABA, that stimulates beta-2 receptors to relax airway smooth muscles. Labetalol, a non-selective beta blocker, can interfere with this action and may even trigger bronchospasm, posing a significant danger in clients with asthma. While the other medications, lithium, captopril, and clonidine, affect different receptor systems or organ systems, they do not directly interfere with bronchodilation or increase respiratory risk. This question highlights a key NCLEX principle. Always check for beta blocker use in respiratory clients. Additionally, salmeterol is for maintenance, not for acute attacks, and clients should be educated to use a short-acting beta agonist, like albuterol, as their rescue inhaler when symptoms occur. Moving into surgical safety and allergy screening, let us look at question 45. During a preoperative assessment, the nurse is reviewing a client's health history before surgery. Which of the following client statements should raise concern for a potential latex allergy? The options include A. I always get a mild rash when I wear wool sweaters. B. Certain soaps make my hands dry and itchy. C. I get tingling in my mouth when I eat bananas and kiwis. And D. I developed nausea after taking codeine for pain last year. The correct answer is option C. I get tingling in my mouth when I eat bananas and kiwis. This symptom is a classic sign of latex fruit syndrome, where cross-reactivity between latex and specific fruits, like bananas, kiwis, avocados, and chestnuts, triggers oral or systemic allergy symptoms. It is a red flag that must be documented and communicated to the surgical team. Option A indicates a mild contact sensitivity to fabric, not an immunologic concern. Option B refers to irritant dermatitis, which is not the same as an allergic reaction. Option D is about a side effect from medication, not an allergy to latex. Remember, clients with spina bifida, multiple surgeries, or frequent latex exposure are at high risk for developing latex sensitivity. Early recognition can help prevent intraoperative anaphylaxis, which can be fatal. Hold up, what if I told you there is a shortcut to mastering the NCLEX? For a limited time, you can access our complete NCLEX crash course for absolutely free for 5 days. That is thousands of exam-style questions, clinical simulations, bite-sized video reviews, and guided study plans, all without paying a single rupee. All you have to do is click the WhatsApp link in the description and say, "Hi." We will unlock your access instantly. No strings attached. This is your shortcut. Use it. Now, back to your lecture. Let us keep leveling up. Now let us shift to post-operative monitoring with question 46. A nurse is caring for a client who is 6 hours post-laparoscopic appendectomy. Which of the following findings requires immediate follow-up by the nurse? The choices are A. Incisional pain rated 6 out of 10. B. Oral temperature of 99.5 degrees Fahrenheit, 37.5 degrees Celsius. C. Heart rate of 112 beats per minute. Or D. Hypoactive bowel sounds in all 4 quadrants. The correct answer is option C. Heart rate of 112 beats per minute. Although this might seem like a mild increase, tachycardia is often the first compensatory sign of early hemorrhage or shock, especially in the hours after surgery. It requires immediate investigation and vital sign trending. Option A represents expected post-surgical pain. Option B is a low-grade fever, which is a normal inflammatory response. Option D, hypoactive bowel sounds, is also expected after abdominal surgery due to transient ileus and anesthesia effects. The priority here is subtle but important. Vital sign changes, especially increased heart rate, can be an early clue to serious post-op complications like bleeding or sepsis. Always assess early, act fast, and report concerns. Let us now apply math skills with question 47, which focuses on fluid balance. The nurse reviews the client's total intake for a 12-hour shift. The client drank 3 8-ounce cups of water, received 0.9% sodium chloride at 70 milliliters per hour continuously for 12 hours, was given 500 milligrams of azithromycin in 250 milliliters of normal saline, and received 5 milligrams of morphine diluted in 7 milliliters of fluid. What is the client's total fluid intake in milliliters? The options are A. 1,273 milliliters, B. 1,500 milliliters, C. 1,807 milliliters, and D. 1,930 milliliters. The correct answer is option C, which is 1,807 milliliters. Let us break it down step by step. The client drank 3 cups of water, each containing 8 ounces. That totals 24 ounces. And when we convert ounces to milliliters by multiplying 24 by 30, we get 720 milliliters of oral intake. Next, the client received normal saline at a rate of 70 milliliters per hour over a period of 12 hours. 70 multiplied by 12 equals 840 milliliters. Additionally, the client was given azithromycin, which was diluted in 250 milliliters of normal saline. Finally, the morphine was diluted in 7 milliliters of fluid. Adding all sources together, 720 from oral intake, 840 from the IV fluid, 250 from the antibiotic, and 7 from the morphine, we get a total of 1,817 milliliters. The closest answer choice is 1,807 milliliters, which is option C. This minor rounding difference is considered acceptable in clinical settings. Nurses must be able to accurately track all intake sources, including oral fluids, intravenous infusions, and medication diluents, to maintain proper fluid balance and prevent complications. Finally, let us talk about emergency response with question 48. A nurse is assessing a client who collapsed while walking in a park. The client is unresponsive and does not have a detectable pulse. What is the nurse's first action? The options are A. Provide 2 rescue breaths, B. Begin chest compressions, C. Move the client to a shaded area, or D. Ask another provider to confirm the carotid pulse. The correct answer is option B. Begin chest compressions. When a client is found unresponsive and pulseless, the priority intervention is immediate chest compressions. You do not wait for additional confirmation or reposition the client unless the environment is dangerous. High-quality CPR requires starting compressions at a rate of 100 to 120 per minute and a depth of at least 2 inches in adults. If no pulse is detected within 10 seconds, start compressions immediately. Remember, early compressions can double or triple survival rates in cardiac arrest. Now let us continue with question 49, where we shift our focus to preoperative lab evaluation. The nurse is reviewing laboratory results for a client scheduled for surgery. Which lab value requires immediate follow-up before proceeding with the operation? The choices are A. Sodium, B. Potassium, C. Blood urea, nitrogen, BUN, and D. Creatinine. The correct answer is option B. Potassium. Abnormal potassium levels, whether too low or too high, pose a serious risk to cardiac stability during anesthesia. Even mild hypokalemia can lead to life-threatening arrhythmias, especially during surgical stress or with the use of anesthesia agents. While sodium imbalances may cause neurologic symptoms, they are typically less acutely dangerous than potassium shifts. Option C, with a BUN of 8 milligrams per deciliter, is within the normal range. And although option D, creatinine, may reflect mild renal impairment, it does not carry the same immediate cardiac risk as potassium. Remember, normal potassium values range from 3.5 to 5.0 milliequivalents per liter, and any deviation should be corrected before surgery. Even small fluctuations can cause flattened T waves, U waves, and potentially fatal dysrhythmias during the intraoperative period. Heading into geriatric care, question 50 evaluates our understanding of immobility complications. A nurse is assessing a 90-year-old client who has been bedridden at home for 2 weeks. Which of the following findings is not typically associated with prolonged immobility? Your options are A. Decrease in bone density, B. Loss of short-term memory, C. Development of atelectasis, and D. Elevated serum calcium level. The correct answer is option B. Loss of short-term memory. While prolonged immobility causes a cascade of complications across multiple systems, like bone demineralization, atelectasis, and hypercalcemia, cognitive changes like memory loss are not directly caused by immobility. Instead, memory impairment may stem from age-related dementia, depression, or medication effects, and should trigger further neurologic evaluation. Nurses must anticipate these complications early and implement strategies like repositioning, incentive spirometry, and nutritional support to protect these vulnerable clients. And now, question 51, focused on pharmacology. During a medication review, the nurse teaches student nurses about phenytoin. Which student statement indicates a correct understanding of the drug? The choices are A. Phenytoin is a selective serotonin reuptake inhibitor, SSRI, commonly used for epilepsy. B. The therapeutic range of phenytoin is 10 to 20 micrograms per milliliter, and levels above this range can cause toxicity. C. Phenytoin is contraindicated in clients with Parkinson's disease due to worsening symptoms. And D. Phenytoin is metabolized in the liver and has minimal drug interactions. The correct answer is option B. Phenytoin, an anticonvulsant used to manage tonic-clonic and focal seizures, has a narrow therapeutic range of 10 to 20 micrograms per milliliter. Levels above this can lead to toxicity, with symptoms such as nystagmus, ataxia, confusion, and even seizures. The clinical pearl: monitor phenytoin levels closely, teach clients about toxicity signs, and emphasize dental hygiene, as gingival hyperplasia is a common side effect. Also, always check for potential drug interactions when adding phenytoin to a client's regimen. Let us move into question 52, which focuses on therapeutic effectiveness. A nurse is evaluating a client who has been prescribed silostazol. Which of the following findings best indicates that the medication is having the desired therapeutic effect? The options are A. The client reports no pain while walking. B. The client's total cholesterol has decreased. C. The client reports improved vision. And D. The client is more focused and alert. The correct answer is option A. The client reports no pain while walking. Silostazol is used specifically to treat intermittent claudication, a symptom of peripheral arterial disease that causes leg pain during walking due to poor blood flow. Silostazol works by vasodilating peripheral vessels and inhibiting platelet aggregation, improving walking distance and reducing pain. Option B may seem relevant, but silostazol is not a lipid-lowering medication. Option C, related to vision, and option D, referring to cognition, are unrelated to silostazol's mechanism of action. This is a classic case of matching the drug's therapeutic intent to the client outcome. Now heading into trauma management, we have question 53. A client arrives in the emergency department after a motor vehicle accident and has sustained multiple rib fractures and a nasal fracture. Which finding requires immediate follow-up? Your choices are A. Shallow breathing, B. Chest pain with movement, C. Bruising along the chest wall, and D. Vomiting. The correct answer is option D. Vomiting. While rib and nasal fractures are expected to cause pain and bruising, vomiting after facial trauma, particularly a nasal fracture, can indicate elevated intracranial pressure from a possible brain injury. Vomiting is a hallmark early sign of rising intracranial pressure and should prompt immediate neuroimaging, usually a head-computed tomography scan. Options A and B are common with rib fractures due to the pain of expansion. Option C is localized bruising, which is also expected in chest trauma. Up next is question 54, where we address non-pharmacologic sleep support. A client reports difficulty falling asleep and feeling unrested in the morning. After reviewing the clinical data, what is the most appropriate nursing action to promote sleep? The options are A. Offer the client a light snack before bedtime. B. Encourage the client to take multiple naps during the day. C. Administer prescribed as needed dose of lorazepam for poor sleep. And D. Give the client a dose of albuterol before bed to optimize breathing. The correct answer is option A. Offer the client a light snack before bedtime. Light snacks, especially those containing complex carbohydrates or tryptophan-rich foods like warm milk, support serotonin release, stabilize blood sugar levels, and reduce sleep disturbances. Option B disrupts the sleep cycle and interferes with nighttime rest. Option C, while sometimes used, is not the best first-line strategy due to the risk of dependency and sedation. Option D is inappropriate unless the client has active respiratory symptoms. Albuterol can actually cause restlessness and insomnia. Transitioning to nursing leadership, we have question 55. A registered nurse in the emergency department is working with 2 licensed practical nurses. One LPN is assigned to give all medications, while the other completes medication reconciliation and performs 12 lead ECGs. What care delivery model is the RN using? Options are A. Team nursing, B. Case management, C. Functional nursing, and D. Primary nursing. The correct answer is option C. Functional nursing. In this model, tasks are divided among staff based on roles, not patient. One nurse handles all medications, another handles diagnostics or documentation. Option A, team nursing, involves collaborative client-centered care with shared responsibilities. Option B, case management, focuses on long-term, interdisciplinary coordination, not shift-based delegation. Option D, primary nursing, involves one RN overseeing a client's care from admission to discharge. Hold up! Before we dive deeper, here's a quick opportunity you do not want to miss. If you are serious about passing the NCLEX on your first try, our free 5-day access to the complete NCLEX crash course is your golden ticket. You will get expert-led sessions, over 5,000 NCLEX-style questions, case studies, priority setting strategies, and downloadable guides, all designed to give you real exam confidence. And the best part? No credit card required. Just click the WhatsApp link in the description and say hi to get started. Thousands of future nurses are already leveling up. Do not be the one left behind. Now, let us jump back into the lecture. Finally, for question 56, we are educating women on toxic shock syndrome, TSS. Which woman is least likely to be at risk? The choices are A. A teenage girl using a high-absorbency tampon, B. A 29-year-old woman using a cervical cap, C. A 31-year-old woman using a diaphragm, and D. A 35-year-old woman using oral contraceptives. The correct answer is option D, a 35-year-old woman using oral contraceptives. TSS is linked to prolonged use of internal devices, such as tampons, diaphragms, and cervical caps, which can harbor Staphylococcus aureus and create the perfect environment for toxin production. Oral contraceptives involve no internal insertion, making them unrelated to TSS risk. Options A, B, and C all represent higher risk behaviors if the devices are not used and changed properly. Let us now move on to question 57, where early recognition of post-surgical complications can be life-saving. A nurse is assessing a post-operative client on the second day after abdominal surgery. The client reports a dull ache in the right calf and a funny feeling in the toes. What is the most appropriate nursing action? The options are A. Elevate the legs and encourage fluid intake. B. Instruct the client to remain in bed and notify the primary healthcare provider. C. Encourage the client to massage the leg to improve circulation. Or D. Ambulate the client and explain the risks of bed rest. The correct answer is option B. Instruct the client to remain in bed and notify the primary healthcare provider. These symptoms raise suspicion for deep vein thrombosis, DVT, a potentially dangerous post-operative complication. The nurse's priority here is to prevent embolization. The client should be kept on bed rest until diagnostic confirmation, usually with a venous Doppler ultrasound. Option A may worsen the condition by encouraging activity. Option C is dangerous. Never massage a suspected DVT site, as this can dislodge the clot. Option D also delays proper evaluation. Transitioning now to radiation safety in question 58. A nurse is caring for a hospitalized client who has an internal radiation implant. Which action is inappropriate and should be excluded from the plan of care? The options are A. Wearing gloves when handling the client's bedpan. B. Leaving soiled linens in the used linen bin inside the client's room. C. Wearing a lead apron while providing direct care. Or D. Placing the client in a semi-private room at the end of the hallway. The correct answer is option D. Placing the client in a semi-private room at the end of the hallway. Clients receiving internal radiation, brachytherapy, must be placed in a private room to minimize radiation exposure to others. Option A is appropriate for standard precautions. Option B is acceptable because linens may be contaminated with radioactive material and should remain in the room until safely collected. Option C, wearing a lead apron, is essential during close care. Let us now tackle safe client handling with question 59. While ambulating a client wearing a gait belt, the nurse observes the client begin to fall. What is the best immediate action the nurse should take to reduce the risk of injury? The options are A. Hold the gait belt, extend one leg, let the client slide down the leg, and gently lower the client to the floor. B. Release gait belt, hold the client under the arms, and lower them to the floor. C. Instruct the client to fall onto their side while supporting the gait belt. The D. Hold the gait belt and lower the client using a narrow base of support. The correct answer is option A. Hold the gait belt, extend one leg, let the client slide down the leg, and gently lower the client to the floor. This technique controls the fall while minimizing trauma. The extended leg acts as a guide to lower the client slowly and protect their head. Option B is unsafe. Releasing the gait belt or grabbing under the arms risks injury. Option C is impractical, as clients cannot be coached mid-fall. Option D is incorrect because a wide base of support, not a narrow one, is needed for stability. And finally, we have question 60, which highlights the importance of screening for intimate partner violence, IPV. During a routine prenatal visit, the nurse is screening a pregnant client for signs of IPV. Which of the following findings is least likely to suggest IPV? The options are A. Depression, B. Weight gain, C. Unexplained bruising, or D. Delayed initiation of prenatal care. The correct answer is option B. Weight gain. In pregnancy, weight gain is expected and is not a red flag for abuse. However, depression, unexplained bruising, and delayed prenatal care may all signal physical or emotional abuse, coercive control, or neglect. These warning signs demand compassionate, private screening using trauma-informed care. Let us begin this round with question 61, which focuses on precise medication calculations for emergency care. A client with an acute ischemic stroke has been prescribed alteplase at a dosage of 0.9 milligrams per kilogram. The client weighs 116.82 kilograms. What is the total prescribed dose in milligrams? You are asked to record your answer as a whole number. To calculate this, we multiply 0.9 by 116.82, which equals 105.138 milligrams. Rounded to the nearest whole number, the correct answer is 105 milligrams. However, it is important to note that in clinical practice, the maximum dose of alteplase is capped at 90 milligrams. Even so, for NCLEX purposes, you are expected to give the calculated dose unless otherwise stated in the question. Next is question 62, highlighting medication safety in clients with cardiovascular risk. A nurse is reviewing a client's health history before administering celecoxib. Which of the following conditions should prompt the nurse to question the prescription? The options are A. Osteoarthritis, B. Gout, C. Recent myocardial infarction, or D. Migraine headaches. The correct answer is option C. Recent myocardial infarction. Celecoxib is a COX-2 inhibitor, which, while effective for pain and inflammation, carries a significant cardiovascular risk. It can increase the likelihood of myocardial infarction or stroke, especially in clients with a prior history of cardiac disease. Option A is incorrect. Celecoxib is FDA approved for osteoarthritis. Option B is also incorrect. Some NSAIDs, including celecoxib, may be used for gout. Option D is not ideal, but celecoxib can be used as part of a broader migraine pain management plan. Let us now advance to question 63, which emphasizes prioritization of care in critically ill clients. The nurse is prioritizing client care. Which of the following findings requires immediate nursing intervention? Your options are A. A client with osteomyelitis receiving intravenous antibiotics has a temperature of 103.4 degrees Fahrenheit, or 39.7 degrees Celsius. B. A client with viral hepatitis who has persistent nausea and vomiting. C. A client with septic shock who has a mean arterial pressure of 56 millimeters of mercury after a fluid bolus. Or D. A client with diverticulitis reporting pain rated 7 out of 10. The correct answer is option C. A client with septic shock who has a mean arterial pressure of 56 millimeters of mercury after a fluid bolus. This is a critical red flag. A MAP less than 65 indicates inadequate organ perfusion, even after initial fluid resuscitation. This client may now require vasopressors and intensive monitoring. Option A is concerning but expected in infection. Option B may require antiemetics and fluids but is not immediately life-threatening. Option D involves pain but does not supersede circulatory collapse. Question 64. Where developmental stage guides your nursing priority? A nurse is working with a 17-year-old adolescent diagnosed with cystic fibrosis. What is the most important nursing priority for a client of this age? The options are A. Providing disease education and teaching about cystic fibrosis. B. Encouraging interaction with peers to reduce isolation. C. Promoting independence in decision-making by involving the client in care. Or D. Emphasizing the importance of school attendance and education. The correct answer is option C. Promoting independence in decision-making by involving the client in care. Adolescents, especially those nearing adulthood, need to be actively engaged in their care to foster autonomy, promote adherence, and prepare for the transition to adult healthcare systems. Option A is important, but it becomes more effective when paired with autonomy. Option B is helpful, but not the top priority. Option D, while relevant, is not the developmental focus for chronic illness management. Moving into critical endocrine emergencies, let us take a closer look at question 65. A nurse is caring for a client experiencing an Addisonian crisis, also known as acute adrenal crisis. Which intravenous fluid should the nurse prepare to administer? The options are A. Lactated ringers, B. 0.9% sodium chloride, normal saline, C. Dextrose 5% in water, D5W, and D. Dextrose 5% in lactated ringers, D5LR. The correct answer is option B. 0.9% sodium chloride. In an Addisonian crisis, the client experiences profound hypotension, hyponatremia, and volume depletion due to deficient cortisol and aldosterone. Normal saline is the fluid of choice to rapidly expand intravascular volume and correct sodium levels. Option A, although isotonic, does not supply enough sodium to correct the hyponatremia. Option C is hypotonic and may worsen sodium levels. And option D, while supplying dextrose, does not provide adequate sodium and is not the first choice. Hey friend, if this lecture is helping you, imagine what a full crash course could do. You can now grab free 5-day access to our complete NCLEX crash course, packed with live and recorded classes, 5,000 plus practice questions, and full case walkthroughs that actually make sense. No commitments, no payment, just real tools that work. Click the WhatsApp link in the description and send hi to unlock it all. We will get you set up in seconds. All right, back to the lesson because you are doing amazing, and we are here to help every step of the way. Now, shifting our focus to prioritization of care in complex renal and fluid scenarios, we have question 66. The nurse is assessing several assigned clients. Which client should the nurse prioritize for immediate follow-up? The options include A. A client being treated for acute glomerulonephritis with periorbital edema. B. A client with urolithiasis who reports persistent nausea. C. A client receiving continuous bladder irrigation who reports the urge to void. And D. A client who just returned from hemodialysis and reports dizziness. The correct answer is option D. A client who just returned from hemodialysis and reports dizziness. This is a red flag for fluid volume depletion or hypotension, which are common post-dialysis complications due to excessive ultrafiltration. It could lead to syncope or even shock and requires immediate evaluation of vital signs and perfusion. Options A, B, and C involve symptoms that are either expected or stable and can be addressed after the urgent circulatory issue is managed. Let us now turn to cardiac interpretation with question 67. A nurse is interpreting an electrocardiogram showing sinus tachycardia. Which of the following medical conditions in the client's history would most likely explain this finding? The options are A. Graves's disease, B. Increased intracranial pressure, C. Severe hypothermia, and D. myxedema coma. The correct answer is option A. Graves's disease, which is a hyperthyroid condition that increases metabolic rate and sympathetic stimulation, often manifesting as tachycardia or palpitations. Option B is incorrect, as increased intracranial pressure typically leads to bradycardia, part of the classic Cushing's triad. Option C, hypothermia, slows all body functions including the heart rate. Option D, myxedema coma, is the extreme end of hypothyroidism and results in bradycardia, hypothermia, and reduced responsiveness. Let us now shift to postpartum emergencies with question 68. A postpartum client has soaked 3 perineal pads in 3 hours and has a soft, boggy fundus on palpation. What is the nurse's initial action? The options are A. Insert vaginal packing, B. Massage the fundus, C. Apply an ice pack to the perineal area, and D. Administer packed red blood cells. The correct answer is option B. Massage the fundus. A boggy uterus is a hallmark sign of uterine atony, the leading cause of postpartum hemorrhage. The nurse's first and most effective response is to stimulate uterine contraction by massaging the fundus. Option A is a physician-level intervention, not a nursing priority action. Option C may help perineal swelling, but does not treat uterine bleeding. Option D may be appropriate later, but not before correcting the mechanical issue causing blood loss. Pediatric visual screening case in question 69. A nurse is performing a corneal light reflex test on a child suspected of having strabismus. Which finding confirms the presence of this condition? The options are A. Symmetrical pinpoint light on each pupil, B. Red reflex present in both eyes, C. Asymmetrical pinpoint light on the pupils, and D. Sun setting sign. The correct answer is option C. Asymmetrical pinpoint light on the pupils. Strabismus is a condition in which the eyes do not align properly, and during the corneal light reflex test, light will not reflect evenly from both pupils. Option A indicates normal alignment. Option B checks for cataracts or retinoblastoma, not alignment. Option D refers to increased intracranial pressure and is unrelated to strabismus. Let us kick off this final stretch of questions with question 70, which focuses on cast care education. The nurse is teaching a client who has just had a plaster cast applied to a fractured radius. Which of the following statements made by the client requires follow-up and further teaching? The options are A. If my arm feels itchy, I can use a hairdryer on the cool setting for relief. B. I can reduce my arm's swelling by elevating it with a pillow. C. I should be okay to shower with my cast. And D. It will be normal for me to feel heat after the cast is applied. The correct answer is option C. I should be okay to shower with my cast. Plaster casts are not waterproof, and any exposure to moisture can weaken the structure, promote infection, and damage the skin underneath. A shower without protective covering is never appropriate. Option A is a correct statement. The use of cool air from a hair dryer can help alleviate itching. Option B is helpful for swelling reduction, and option D is expected, as the plaster releases heat while drying. Switching to a high-risk maternity scenario, let us look at question 71. During a shift handoff, the charge nurse receives reports on 4 clients. Which one should be assessed first? The options are A. A client 2 days postpartum reporting sweating and urination. B. A 15-week pregnant client with hyperemesis and nausea after eating. C. A 32-week pregnant client with placenta previa and increased lower back pain. And D. A laboring client with recent early fetal heart rate decelerations. The correct answer is option C. A client with placenta previa and new back pain. This raises red flags for placental abruption, which could lead to fetal hypoxia or maternal hemorrhage. It requires immediate evaluation. Option A is describing normal postpartum diuresis. Option B's nausea is expected in hyperemesis gravidarum. Option D's early decelerations are benign and reflect fetal head compression during contractions. Now, onto a pediatric emergency scenario with question 72. A nurse is caring for a 4-year-old child with 2nd and 3rd degree burns to the chest, abdomen, and legs. The child's vital signs are pulse 117, respirations 44, blood pressure 90/60, and oxygen saturation 88% on room air. What should the nurse do first? The options include A. Obtain IV fluid prescription, B. Prepare for airway intubation, C. Perform wound care, and D. Review lab data. The correct answer is option B. Prepare for airway intubation. With chest burns and signs of respiratory distress and hypoxia, the child is at high risk for airway edema and sudden obstruction. Early intubation is critical before the airway swells further. Option A is important but follows airway management. Wound care and labs come much later in the priority chain. Next, let us examine a prioritization decision in question 73. The nurse is receiving 2 client admissions simultaneously. Which initial assessment is most essential to determine who to see first? The options are A. Vital signs, B. Number of medications, C. Medical history. D. Code status. The correct answer is option A. Vital signs. They give the nurse real-time information about stability and allow for immediate triage. Options B and C are important for comprehensive care planning, but do not determine urgency. Code status matters in emergencies, but here we are identifying who to see first, not planning resuscitation. Let us now transition to pediatric care planning with question 74. The nurse is creating a care plan for a hospitalized toddler with autism spectrum disorder. Which information from the parents is most important to help the child adjust to the hospital setting? The options are A. The child's height and weight, B. The child's bedtime routine, C. The child's vaccine history, D. The child's current medications. The correct answer is option B. The child's bedtime routine. Children with autism thrive on consistency and structure. Preserving bedtime rituals helps them feel safe and reduces stress. And finally, we arrive at question 75, involving wound care for a client with a stage 3 pressure injury. What is the initial nursing action before a dressing change? The options are A. Gather equipment, B. Use non-sterile gloves to remove old dressing, C. Document wound characteristics after cleaning, D. Administer prescribed oral pain medication. The correct answer is option D. Administer pain medication. Stage 3. Pressure injuries are often deep, painful, and involve tissue damage. Pain control is essential for client comfort and cooperation, and must be given early enough to take effect, usually 30 to 45 minutes prior to care. Options A and B are correct procedural steps but follow pain management. Documentation comes at the end.